VAL-083 is a molecule that we identified through screening of the National Cancer Institute database. What we found with VAL-083 is that we attack the cancer through the DNA at a different point. So that MGMT repair mechanism doesn't fix the damage that we cause to the cancer cell, and therefore we're more effective in treating those patients that have a large amount of that enzyme, which represents well over 2/3 of the patients who are diagnosed. Our initial focus with VAL-083 is in refractory glioblastoma, and essentially what that means is we're treating patients that have failed the other available therapies. And unfortunately, today there's nothing available to treat the tumor for these patients, and their prognosis is very poor. Based on the unique mechanism of VAL-083, we believe that we'll be able to do something for these patients, shrink their tumor, have them live longer with a better quality of life. Eventually, we would like to be able to treat patients who are newly diagnosed. Most of the patients today don't respond well to the standard of care for newly diagnosed patients. And we know why that is. There's an enzyme called MGMT which causes resistance to the lead drugs in the market today. We can measure the level of that enzyme. And so for patients who have a lot of it, we'd be able to identify those patients who are unlikely to respond to today's chemotherapy and move VAL-083 into the front line to treat those patients initially.